clinic. And then from then on, I could not get the image. I couldn't even look at her from the outside. Whenever I saw her the look, you know? And I would say, oh, that poor girl, you know, she's got ugly, you know. That's a memory, that's an image that you can't undo. Okay? And it just impressed upon me what smoking can do to your body at a very early age. So she had lots of macrophages that were filled with this stuff. Okay? Because what happens, some of the fine particles that are in the air are going to escape filtration. They're going to reach the alveoli, and then the macrophages come in.
And you said it was called a dust cell, like
Dust cell.
DUST?
So yeah, in the lungs, these macrophages are called dust cells.
Okay.
Now let's look over here. Here is the wall of an alveolus. Here's its lumen. It's lined by type 1 cell. And on the other side, we see a little cross-section through a pulmonary capillary. Okay? This interface here between the air and the bloodstream, okay, right here, is called the respiratory membrane. The respiratory membrane is going to consist of the type 1 alveolar epithelium. It's going to include a fused basement membrane layer. And on the other side, it's going to include the pulmonary capillary endothelium. Pulmonary capillary endothelium. See what happened here? Okay. So, when gas exchange occurs, that oxygen has to cross all three layers. It's got to cross the epithelium of the alveolus. It's got to cross the pulmonary capillary endothelium. And sandwiched between those two epitheliums, you have the basement membrane for each fused together. So you have a middle basement membrane layer. Okay? So the respiratory membrane consists of those three layers. Okay? That oxygen has to cross to reach the bloodstream. This shows you how, when blood vessels enter into the lungs, like this pulmonary artery, it's going to follow the pathway of the airways. So that when the airway branches, so too does the pulmonary artery. Okay? So for each branch of an airway, we're going to have a branching of the pulmonary artery or the pulmonary vein. Okay? So that distally, as the airway gives rise to alveolar sacs, then these little branches of the pulmonary artery are going to give rise to pulmonary capillaries that surround those alveoli. And notice that when they demonstrate here on the diagram, the pulmonary capillaries, half of the pulmonary capillary is blue, the other half is red. Why? Because as that blood picks up oxygen, the blood becomes brighter red. And so the blood that returns to the heart is now fully oxygenated. All right, this is a picture from the outside of the lungs that serves to demonstrate. You can see the horizontal fissure, here's the oblique fissure. The visceral layer of the pleura is the outermost layer of the lung. It's attached. It forms the outermost layer of the lung. The parietal layer of the pleura is attached to the superior surface of the diaphragm, the inner surface of the thorax, so the thoracic cage. Okay? And that potential space between the two, the visceral and parietal layer, is the pleural cavity. Remember that these pleural layers are composed of a serous membrane. Serous membranes or epithelial membranes that line a closed space that doesn't open to the outside. So the pleura is a type of serous membrane. It's made up of a simple squamous epithelium and a small amount of loose connective tissue. In fact, in this location within a serous membrane, that simple squamous epithelium has a special name. It's called what? Jordan.
I didn't know the question.
Mesothelium.
Oh.
So if someone has a malignancy of this mesothelium, that's making up part of the,
There were a lot of
Mesothelioma.
commercials about
we
that.
call it a mesothelioma, right? What's the big risk factor? Is exposure to what? Asbestos. That's enough today.
Dr. Penner, I have a question.
Yes.
If you have nodules on your vocal cords, do you can there be like a factor of like talking weird? Because I've been asked by strangers a few times if I have nodules on my vocal cords. And
Yeah, it can affect your quality of your voice.
Okay, yeah, because strangers have asked me that before.
Yeah, and I can tell that you're probably going to have some trouble in speech. Have you taken speech
I've already
lessons?
taken speech.
Did you have some problems?
He liked when I talked like this, but apparently when I go up in front of people, I talk differently. So he said that my voice changed and that wasn't okay. So I had to re-give a speech a couple of times.
Yeah, I can tell you got some vocal problems there.
It happens.
I'm kidding you. You're fine. Actually, I would think